There is a simple image I use with patients who come in exhausted, thirsty, and convinced their body is betraying them. Imagine your cells as a house full of light bulbs and appliances, and the fuel truck pulls up every day with barrels of gasoline that should light the house, but the front door is padlocked. The fuel sits on the driveway. It is available, abundant, but the people inside can't use it. That is metabolic disease in a sentence. Plenty of energy around, but an inability to access and burn it efficiently. Insulin resistance locks the door. Mitochondria, the tiny energy factories inside your cells, rust and run inefficiently. The result is higher blood sugar, inflammation, and the gradual wear on heart and kidney tissue that underlies type 2 diabetes and cardiovascular disease. Right now, roughly 1 in 10 adults is living with type 2 diabetes or its precursor. Research indicates metabolic dysfunction is a major driver of cardiovascular risk, linked to study. If you stay with me until the end of this piece, I'll walk you through the physiology in plain language, show you the evidence-based levers you can pull today, and give you a single, sensory, practical meal you can make tonight that is deliberately designed to help unlock that padlock and start retraining your mitochondria to work better. If you want these practical metabolic tips delivered reliably, hit subscribe and like so you don't miss future guidance aimed at translating mechanisms into meals and routines. Before we go further, a brief but necessary note. This is educational information, not individualized medical advice. What follows can support metabolic health, but it is not a prescription. If you have insulin-dependent diabetes, advanced kidney disease, are pregnant, or take medications that affect blood sugar, talk to your clinician before making major changes. Consider asking your clinician about tests such as fasting insulin or HbA1c to monitor progress. Studies suggest these metrics give useful insight into insulin resistance and long-term glucose exposure. Link to study. When I explain the core problem in clinic, I like to keep the metaphors consistent. Insulin is the key that unlocks the door so glucose can enter the house. When the lock is stiff, insulin resistance, the key, struggles. Meanwhile, mitochondria are the furnaces and light bulbs inside the house. They need the right fuel and good maintenance to produce steady energy. If you feed them cheap, volatile fuels, ultra-processed foods, and refined starches, they sputter, produce more waste, inflammatory molecules, and reactive oxygen species, and gradually fail to keep up. If you instead provide high-quality, stable fuel, unprocessed fats, protein, fiber, micronutrients, and support mitochondrial repair, the energy factory can recover some function.
The sensory experience matters. The scent of lemon, the sizzle of fish, the contrast of warm and cool on your plate, the crunch of seeds. These cues slow you down and encourage mindful chewing, which itself helps glucose handling by reducing the speed of ingestion and enhancing satiety signals. Why this composition? From a biochemical standpoint, the meal intentionally minimizes rapid glucose availability by limiting refined carbohydrates, maximizes protein and healthy fats to slow absorption, supplies micronutrients, magnesium, potassium, B vitamins such as thiamine, B1, that act as cofactors for energy pathways, and provides polyphenols and nitrates that support endothelial function and mitochondrial efficiency. Think of it as switching from volatile jet fuel back to diesel carefully blended for your old energy generator. Not instant overhaul, but a better, cleaner supply. I'll pause the how-to with a short clinical aside. This meal is generally safe for most adults, but if you have chronic kidney disease, discuss potassium-containing foods like avocado and spinach with your nephrologist. If you take glucose-lowering medications, particularly insulin or sulfonylureas, lowering postprandial glucose significantly can increase the risk of hypoglycemia. Consult your clinician about dose adjustments. For pregnant or breastfeeding people, nutritional needs differ and medical guidance is necessary. After the meal, there are 3 behavioral nudges I ask patients to adopt consistently. First, take a 10 to 20-minute walk. Gentle movement after eating stimulates skeletal muscle glucose uptake via insulin-independent pathways and reduces the post-meal glucose spike. Second, delay your next eating occasion by allowing a window of 12 to 16 hours of mostly fasting between meals, if this is safe for you. A time-restricted eating pattern that many studies suggest can improve insulin sensitivity and support mitochondrial turnover through processes like autophagy. Link to study. Important safety caveat: extended or aggressive fasting is not appropriate for everyone. People on certain medications, with history of eating disorders, pregnant women, and others should avoid intermittent fasting without supervision. Third, include resistance or high-intensity interval training 2 to 3 times per week. Building muscle increases your metabolic sink, more tissue available to take up glucose and use it as fuel, lowering fasting insulin over time. You should also think about the home environment in behavioral terms. The single most effective nudge I've seen is a simple rule. If junk food doesn't enter the house, you won't eat it mindlessly at 2 in the afternoon. Reorganize your shopping list toward whole foods. Keep a jar of mixed nuts and a bowl of fruit visible. Hide or reduce visibility of packaged snack foods. This is not moralizing food choices. It's structuring cues so your physiology and willpower don't fight on the kitchen counter every day.
Gut microbes matter too, but they are not a magic bullet. Beneficial microbes are associated with better insulin sensitivity in population studies, and diets high in fiber and fermented foods tend to promote a favorable microbial profile. However, naming a single bacterial species as the cure is misleading. Use diet to support a healthy microbial environment. Fiber from vegetables, occasional resistant starch from cooled potatoes or lentils, and fermented foods where tolerated. When I first started recommending this plate in my clinic, I remember a patient named Elena, a school teacher in her 50s who had been told she was borderline diabetic for years. She was tired of pills and of vague advice. We sat in the small exam room and I sketched the plate on a paper towel. Greens, salmon, avocado, nuts, a splash of lemon. She laughed at first. That's all? But she committed to trying it 3 times a week, replacing her usual takeout pasta. Within 6 weeks, she reported something striking. She no longer experienced the mid-afternoon energy crash that had driven her to sugary snacks. She slept marginally better, and her hunger between meals dropped. Objectively, her fasting glucose nudged down, and her primary care clinician reduced the dose of a medication after consultation. That anecdote is not a universal promise. Outcomes vary. But it is representative. Practical meals plus consistent behaviors can produce meaningful changes for many people. You will want markers to know if changes are working. Subjective markers include steadier energy, less intense hunger between meals, and fewer cravings for sweets. Objective markers to discuss with your clinician include measures such as fasting insulin to assess hyperinsulinemia,
fasting glucose, and HbA1c for longer-term trends. Consider rechecking these every 3 months when making lifestyle changes. Support your interpretation with a clinician who understands metabolic management. Studies indicate that reductions in fasting insulin and improvements in HbA1c are associated with lower cardiovascular risk. But these are population-level findings and individual trajectories differ. Link to study. A practical shopping and prep guide to make this sustainable. Buy frozen wild-caught salmon fillets. They keep longer and preserve quality. A sack of mixed baby greens. A jar of extra virgin olive oil. 1 bag of walnuts. An avocado or 2 each week. And a jar of plain fermented yogurt. Plan to cook twice a week. Sear 2 fillets at once and store for salads. Roast a tray of sweet potato cubes for 3 meals. And keep washed greens in an airtight container so a sabli in the evening takes 5 minutes. Behavioral science supports planning. When making a new habit, reduce friction by preparing components in batches. There will be resistance. Family preferences, work schedules, budget constraints, and food deserts all make ideal eating harder.
That's why the plate is flexible. Canned sardines, frozen greens, and simple dressings can be both affordable and effective. The objective is not perfection. It's moving the average meal composition toward nutrient density and lower glycemic stress. Let me unpack a couple of the micronutrients I mentioned, briefly and plainly. Magnesium and potassium support electrical gradients in cells and are cofactors for enzymes in energy production. Think of them as maintenance supplies for your energy factory. B vitamins, especially thiamine, are required for the early steps of carbohydrate metabolism. Suboptimal levels hamper efficient fuel processing. Omega-3 fatty acids help maintain the integrity of mitochondrial membranes and reduce inflammatory signaling that otherwise damages cellular machinery. You can get many of these from whole foods on the plate: greens, nuts, avocado, and oily fish. If you consider supplements, discuss dosing and necessity with a clinician. Some people benefit from testing and targeted supplementation, but blanket high-dose recommendations are not appropriate without medical oversight. Let's return to the metaphor. Each meal is a delivery of fuel and maintenance supplies to your house. If deliveries are regular but full of cheap, volatile fuel, the appliances will clog and fail. If you switch suppliers and start sending the right blends with occasional maintenance days, time-restricted eating, exercise sessions, the furnaces regain efficiency and your household energy balance improves. That process is gradual. You should expect incremental improvements, improved satiety, fewer cravings, possibly modest weight loss if caloric balance shifts, and, over months, potential changes in blood markers. It is not an overnight cure, and it should never replace clinician-guided medication adjustments when those are needed. There is a final angle I want to emphasize because it is often overlooked: light and timing. Daily exposure to sunlight, particularly in the morning, helps regulate circadian rhythms, which in turn modulate insulin sensitivity and mitochondrial function. Photobiomodulation, the science behind light's effects on cellular function, is an emerging area, and while the evidence is still evolving, consistent daylight exposure and stable sleep schedules are low-risk behaviors with plausible metabolic benefit. Try to get 15 to 30 minutes of morning light when safe and practical. I've given you the why, the how, and the sensory blueprint. In the next section, I'll walk through a concrete evening menu and a timeline, the 1-hour sequence from shopping to plate to post-meal habits so you can implement this tonight with minimal fuss. For now, take this away. Reduce hidden sugars. Pair protein and healthy fat with your vegetables. Include nitrates and polyphenols. Move after meals and monitor progress with both how you feel and appropriate lab tests.
Guia de estilo e instruções para síntese de fala. Você é um narrador, palestrante, com voz potente, forte e autoritária. O tom deve ser firme e inabalável. Contexto de continuidade. A frase anterior era with both how you feel and appropriate lab tests. Você está no meio de uma frase-pensamento. Mantenha o ritmo e a força vocal sem quebrar a conexão. Haja como se estivesse transmitindo uma verdade fundamental. If you're ready to try the meal, make an ingredient list tonight and plan to prepare it once this week. If you want, tell me what your baseline looks like, your typical breakfast, lunch, and snacks, and we can adapt the plate to fit your reality without turning your life upside down. Start the timer. 60 minutes from kitchen to post-meal routine. 0 to 10 minutes. Quick mise en place. Preheat oven to 425 degrees F, 220 C. Line a sheet pan with foil. Rinse and cube 1 medium sweet potato, about 200 grams. Toss with 1 tablespoon olive oil, salt, pepper, and a sprinkle of smoked paprika. Spread on the pan. Pat 2 frozen wild salmon fillets dry, brush lightly with oil, season with salt, pepper, and lemon zest. Have an avocado, slice a lemon, and measure a cup of mixed baby greens. Crumble 2 tablespoons walnuts. 10 to 25 minutes. Roast and sear. Put sweet potato in oven. After 10 minutes, heat a heavy skillet over medium-high and sear salmon skin side down 3 to 4 minutes. Flip and cook 2 to 3 minutes more until opaque. Salmon and sweet potato finish around the same time. While cooking, stir a quick dressing. 2 tablespoons plain yogurt, 1 tablespoon olive oil, squeeze of lemon, pinch of salt, minced garlic, optional, and black pepper. Thin with water if needed. 25 to 35 minutes. Assembly and plating. Let salmon rest 2 to 3 minutes. Toss greens with a little dressing, top with warm sweet potato cubes, flake salmon over the salad, add avocado slices and walnuts. Finish with a grind of black pepper and extra lemon if desired. 35 to 50 minutes. Post-meal movement. Walk 10 to 15 minutes at a brisk, conversational pace. Gentle activity helps glucose handling and digestion. 50 to 60 minutes. Tidy and track. Put leftovers in a shallow container for easy reheating. Take a moment to note how you feel, satiety, energy, cravings. If you use glucose monitoring, record the post-meal value at the appropriate interval your clinician recommends. Variations. Swap salmon for canned sardines or roasted tofu. Sweet potato for roasted beets. Yogurt dressing for olive oil plus vinegar. The point, a protein plus healthy fat plus fiber-rich veg meal, cooked simply and repeated, builds metabolic momentum. Shopping list. Core, 1 week supply. Produce. Mixed salad greens, baby spinach, arugula, 2 to 3 lemons, 3 to 4 avocados, 3 to 4 medium sweet potatoes, 1 to 2 heads of broccoli or a bag of broccolini, 1 to 2 red onions, garlic, a small bunch of herbs, parsley or cilantro, berries, fresh or frozen. Protein, wild salmon, fresh or frozen fillets, canned sardines, extra firm tofu, 6 to 8 eggs, plain Greek yogurt, full fat or 2%, low sodium chicken breasts or thighs, fats and seeds, extra virgin olive oil, walnuts, almonds, chia seeds, pantry and flavor, plain vinegars, apple cider, red wine, Dijon or whole grain mustard, smoked paprika, ground cumin, black pepper, sea salt, capers, low sodium soy sauce or tamari, canned tomatoes, no sugar added. Guia de estilo e instruções para síntese de fala. Você é um narrador, palestrante, com voz potente, forte e autoritária. O tom deve ser firme e inabalável. Contexto de continuidade. A frase anterior era: Review the week and plan next week's shopping. Esta é a conclusão. Aumente a emoção para o nível máximo, mantendo a potência, e termine com uma pausa solene e impactante. When to check in with a clinician. Sudden or unexplained weight loss, recurrent hypoglycemia, a rise in fasting glucose despite adherence, or new symptoms, leg swelling, shortness of breath, fainting, merit prompt medical review. If you plan sustained changes in carbohydrate structure or caloric intake, and you are on glucose-lowering medication, arrange a medication review before making large shifts. Final practical points. Simplicity beats perfect. A repeated, simple plate that fits your life is more effective than a perfect plate you cannot maintain. Use light and sleep as non-diet levers. Morning daylight, consistent bedtime, and avoiding late-night bright screens support metabolic rhythm. Food is one lever among many. Combine steady meals that pair protein, fat, and fiber with timely movement and sleep to see incremental, durable change. If you want, tell me one realistic baseline day, what you ate yesterday from waking to bedtime, and I'll show exactly how to shift that into a meal plan that keeps your routine intact while nudging your metabolism in the right direction.